One of today's biggest unmet medical needs is finding a cure for diseases associated with ageing, such as diabetes, Alzheimer's and autoimmunity. Drug discovery company Methuselah Health has revealed new insights into why we develop these degenerative diseases and why the answers to a cure may lie in our proteins rather than our DNA. Louise Beale went to Cambridge, home to the prestigious university and many landmark scientific discoveries, to find out more.
Cambridge, one of our oldest cities, home to one of the most prestigious universities in the world. It was in this town that scientists first split the atom, where they discovered the structure of DNA and where the theories of evolution and gravity were developed. And now a drug discovery company based here on the outskirts of Cambridge say they're on the brink of the next big discovery, finding a cure for ageing diseases like Alzheimer's and diabetes. The head office of Methuselah Health may look fairly ordinary, but what they're working on here is anything but. They've discovered why we develop particular diseases as we get older, and it's not down to our DNA. It's thanks to damage in our proteins.
All the work that's been going around the globe, much of that has been focused on the genetic plans. And very much like a house, if you have a leaking pipe, there's not much use calling up the original architect and asking him what the problem is. You need a plumber to come and look at the actual pipe, the actual problem. And what we've done at Methuselah is we've shifted that focus from the genetics, which tells you in an ideal world how your body would function, to the now. This is how your body functions now, and this is what is going wrong with it. And that answer, that lies in the proteins.
The team at Methuselah Health have been working in collaboration with the Cambridge Centre for Proteomics. Here, they've been able to develop the first tools of measuring protein damage using the university's mass spectrometers. They hope their findings will soon help the development of drugs for degenerative diseases such as Alzheimer's, dementia, osteoarthritis and diabetes.
So we take a protein sample from a healthy individual or somebody with a disease, and that sample the proteins in that sample are chopped up into individual blocks, which are then fed slowly into the mass spectrometer, which weighs them very accurately and enables us to determine whether or not there's been damage to an individual block. And we take those blocks then and reconstruct the proteins so that we can understand which proteins have been damaged, and we're using that information to lead drug discovery efforts to target those diseases.
But none of this would have come about if it wasn't for the genetics biologist Professor Miroslav Radman. I met him at a significant spot for science in Cambridge to find out why.
Yes, indeed. It's an old Cavendish laboratory where in 1953 Watson and Crick designed for the first time the structure of DNA.
Professor Radman and Methuselah's Dr. Granger met by chance 5 years ago. It was only when they talked about Professor Radman's research into radiation-resisting bacteria that they realised they were onto something.
All materials, biological materials, rust. They corrode. They are not diamonds, okay? And that's why we age. The proteins age by suffering more and more of oxidation, of corrosion, of damage. And by suffering the damage, since they are function, comes the misfunction or malfunction that we call aging. This is not such a great discovery as it is turning the head into another direction, looking at the same thing from a different angle.
Professor Radman still works closely with Methuselah, who are excited for what their work might mean in the future.
If we can understand the pathways that are responsible for causing these diseases, then that opens the door to cures. These diseases, cost millions. They affect hundreds of thousands of people every year, and the opportunity to take away that disease burden in the way penicillin took away infectious diseases, is an opportunity that excites us enormously.
Methuselah Health hope within the next 10 years they can turn their world-leading research into new medicines, even cures, and change all our lives dramatically.